Next, we're going to hear from Adi Abulafia. Dr. Abulafia is here with us today from Israel. He completed his anterior segment fellowship under Graham Barrett in Western Australia and has served as the director of the IOL Calculation and Biometry Unit of the Ental Medical Center in Tel Aviv. And he's presently the director of the cataract services at the Sher Zedek Medical Center in Jerusalem. Dr. Abulafia has been the author of four Journal of Cataract and Refractive Surgery editorials, numerous publications, and is really best known for his work in astigmatism analysis and the toric intraocular lens. He's also a member of the ASCRS IOL Power Calculation Subcommittee, and he's going to speak to us today about posterior corneal astigmatism and the Abulafia-Koch Hill-RBF Artificial Intelligence Toric Calculator. Thank you, Adi.
Thank you so much, Warren. You are going to hear from Warren and Helga all about the Hill-RBF calculator and about its wonderful accuracy. But one has to remember that many of our cataract patients will suffer from corneal astigmatism as well, which should ideally be treated with toric IOLs at the time at cataract surgery. And so what is more obvious than to have a Hill-RBF toric calculator? Well, toric calculators are considered to be the choice for these patients. However, the results following their implantations can be sometimes unpredictable, since corneal astigmatism measurements, the methods of calculation, surgically induced astigmatism, and toric IOL misalignments are all factors that might contribute to unexpected residual astigmatism. And today I want to focus about the methods of calculation. So it's been 6 years now since Dr. Koch had reminded us the role of the posterior cornea in toric IOL calculations, and that standard keratometry and topography machines tend to yield inaccurate results in assessing the net corneal astigmatic power. What they do, they measure the anterior cornea and they extrapolate the posterior cornea by using a fixed ratio, which is not correct. So Dr. Koch and his group evaluated the posterior cornea in a large group of patients using a Dowell Scheimpflug device, and what they found out was that most of the posterior corneas were steep along the vertical meridian. Now, since the posterior cornea acts like a negative lens, it will actually create a net plus power along the horizontal meridian, inducing against the rule astigmatism. Another finding in the study was that in with the rule eyes, the more curvature in the front was correlated to more curvature in the back, whereas for against the rule eyes, there was no correlation between the magnitude of the front and the magnitude of the back surfaces of the cornea. They also found that there was much individual variability exceeding at extremes over 0.5 diopters. So based on their findings, they developed the Baylor Nomogram in order to address the posterior corneal astigmatism effect. And since then, a great deal of work has been done in order to refine our understanding of the posterior cornea and to find more accurate measurements in how to do our toric calculation in our daily practice. So basically, two approaches have been taken. The first is the use of mathematical models, which actually takes anterior corneal-based measurements and calculate a new estimated net corneal astigmatism, and the ultimate goal, direct measurements of the posterior cornea. And today I would like to focus on the Abulafia-Koch formula. And this formula is based on a regression model, and it was developed in order to compensate for the posterior corneal astigmatism effect. So what it does, it takes anterior curvature-based corneal measurements and calculate a new total corneal astigmatism with a new magnitude and a new meridian. So let's see one example. If we take 1.5 at 100 degrees, it will transfer that into 0.92 at 105 degrees. So we published a paper about this formula like 2 years ago, and the purpose of it was to compare the accuracy of two models of toric IOL calculators with or without the adjustments of the Abulafia-Koch formula, and to compare those results to the Barrett toric calculator. So for developing the formula, we used Lenstar measurements from the Ental Eye Center from Tel Aviv, Israel, and for validating it, we used the OWL Master 500 measurements from the Lion Eye Institute in WA, Australia. And for the method of calculation, we compared the Alcon model, which is the previous Alcon model, which used a fixed ratio in order to calculate the estimated toricity at the corneal plane, and the Holiday and the Baylor Toric calculator, which use the effective lens position for the same purpose. Now, both the Alcon and the Holiday models were evaluated with or without the adjustments of the Abulafia-Koch formula. In order to exclude the influence of the SIA and torical misalignment, we used post-operative corneal measurements and the actual post-operative torical axis alignment. And bearing in mind that astigmatism is a vector, the main idea was to try to figure out the nature of the correlation between the X and Y components of the anterior curvature-based corneal measurements and the estimated net corneal astigmatism. And we did find a high correlation between the measurement corneal astigmatism by the Lenstar and the estimated corneal astigmatism, total corneal astigmatism. And although we tried many sophisticated ways to improve it, it seems like a simple linear regression did the best for our data set. So then we needed to validate the formula, and in order to calculate the errors in the predicted refractive astigmatism, we did a vector analysis, and the results are, you can see it just here, the error in predicted residual astigmatism for both the calculators without any adjustments. Both of them had against the rule prediction errors with a center rate of more than 0.5 diopters. However, applying the regression formula shifted all these errors back to the center with the center rate prediction errors which were close to zero. Now these results were very similar to those of the Toric calculator. Doesn't seem to move anymore. Can somebody help me with the slides? Maybe the battery is off. Yeah, now it's shifted along. Can you take it back, please? Way back. So, sorry for that. Well, you saw everything now. I don't need to talk. Okay, so now we're all right. Okay, so the results were similar to those of the Toric calculator. So the conclusion of our study was that the prediction of the post-operative astigmatic outcomes can be optimized by adjusting standard torical calculators with the new formula. Now, just remember when using mathematical models, never use them together with total corneal astigmatism measurements, because then you'll be correcting the same problem twice and you will get it wrong. Also, it is important to take care not to use the mathematical models with unusual corneas like keratoconus or post-refractive corneas, because they were not designed to do so. So how does the new Hill-RBF Toric calculator works? So for the spherical equivalent prediction, it uses the Hill-RBF calculator. And for the torical cylinder power, the corneal plane, it's using the effective lens position. And for the total corneal astigmatism, it uses the Abulafia-Koch formula. And I'm very happy that Haag-Streit and Dr. Hill chosen our formula to be on the Lenstar, because this is one of my favorite devices to measure corneal astigmatism. And here I'm going to echo the two previous talks, because this, the Lenstar is not just like a black box where you push buttons and get numbers. You can actually see the measurements, and you can go quickly through the measurements, and then you can delete the ones that you don't like, and you get a new sets of Ks with standard deviation both for the flat K and the steep K, and also for the steep meridian, which is very reassuring. So let's go quickly through one calculations together. So this is a 59-year-old female. She has cataract and withdrawal astigmatism. So the first thing I do, as you might, I'm looking at the mirrors and I see that they are okay. Then I'm making sure that we are dealing with a pretty regular and symmetrical astigmatism. And then it's advisable to follow Warren Hill's methodology and to use primary and secondary supporting instruments in order to determine the steep meridian. And then you can do the same for the power difference between the meridians. And let's look at the different calculators here. So if you look at the Holiday calculator, you will probably pick a T5 or T6 for this patient. The Olson with the standard calculator T5. the Hill-RBF, you would probably pick a T4, and also for the Barrett. And for the spherical equivalent, all of them agree that it should be 22.5. So this lady had uneventful cataract extraction with a T4 lens implantation, and the final axis 93, just 1 degree off depending on which calculator do you look at. Post-op refraction, plano minus 0.25 at 5, so slightly with the rule residual astigmatism. And if you look at the error in the predicted refractive astigmatism, both the Holiday and the Olson calculators yielded significant against the rule prediction errors, whereas using the Barrett and the Hill-RBF Toric calculator yielded prediction errors which were close to 0. Thank you.
Thank you, Adi.